Looks like we did it.
Good job.
That's so good.
It's probably the time, you might have to adjust the time. There's a time, where's it at? Probably is.
Display capture.
Should I go look at it?
Capture device.
Welcome everyone to the July 23rd, 2020 meeting of the Hamilton County Board of Education. I'd like to ask for your consideration of the open session communications. Entertain a motion to accept the agenda as presented. Motion by Ms. Adams.
For some reason, the sheet looks frozen. Sheet looks frozen.
Seconded by Mr. Rochelle. All in favor, say
Let's
aye.
stop.
Opposed, motion carries. If you would please consider a moment of silence, please. Thank you very much. Public comment? All right. So citizens or residents of Camden County who have signed up to address the board will be called up and sign up order. Each individual speaker will be allowed 3 minutes for remarks. Issues or concerns involving personal complaints related to identifiable school personnel or student matters are not appropriate for this public forum. After 30 minutes of public hearing, any speakers remaining will be recognized at the end of the agenda. And we have signed up Mr. Arthur.
Good evening. My name is Tammy Williams-Barclay, citizen of Camden County. My husband and I have 2 children in Camden schools, 7th and 5th grades, and I would like to express the importance of our children returning to school. I'm the team lead of the nuclear medicine department at Centera Albemarle Medical Center, where I've been employed for the past 18 years. When the school system shut down on March the 13th, my husband and I remained working. At first, going to work was not easy. I would come home each day exhausted, wearing all the appropriate PPE that is still required today. The unknown was very scary, and it still is. I would like to express to you tonight that we are living in a different day, that we at the hospital have learned to adapt and pull together
I
as
think
a
the
team.
video was frozen. We
And
have
Camden
audio.
County schools can do the same. We have banners at the hospital entrances that say heroes work here. Our teachers and staff of all the schools here in Camden are our kids' heroes. They look up to you and love and miss each of you so very much. I see my boys and I know the need and their want to return to school. It is affecting my own kids, and I am not alone. I've spoken with Dr. Christopher Rogers, lead physician for general surgery at the hospital just today. He gave me permission to quote him, and I will share with you now. The need for face-to-face instruction in the classroom is vitally important for the development of our children. Schools can use this time to instruct, practice, and teach the importance of public health among our children, which it will only benefit them as they grow and mature to adulthood. With the use of real practical monitoring and sanitizing of the schools, kids will learn how to remain safe and healthy. The lockdown we experienced was definitely important, but we have learned and grown through our experiences. He wanted me also to share with you that he respects your decision and knows you will do what is right for the kids of Camden County. My friend and Camden resident Susan Lamb Tatum wanted me to share with you also. She couldn't be here tonight. Per the Department of Health and Human Services, Camden has had 50 cases and 2 deaths. We are not Raleigh or Charlotte. Eastern North Carolina should not be treated as a hot spot. There are so many Facebook posts from parents about private schools, private tutoring, and parent lies. This will decrease the funds for the school system. What about the kids who rely on their source of food from our schools? Kids do not have home support to encourage virtual learning, do not have strong internet, or simply do not learn well virtually. There is no right answer, and I truly do see both sides. I see it every day. But I know prayerfully that we will make the right decision. Thank you for your time.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consent agenda. Motion by Ms. Abbott to approve the consent agenda. Seconded by Mr. Purcell. Is there any discussion? All in favor say aye. Opposed? Motion carries.
It's good now.
Demetra is here tonight to like to give us an update on COVID-19 crisis medical perspective. Demetra?
First of all, I wanted to thank you for the opportunity to talk to you all.
Can't hear you back here?
Sorry, should I get over there? Oh.
That's right.
First of all, I'd like to thank you for allowing me this opportunity to talk. I'm a practicing physician at Center Lee Hospital. I've been living in Camden County for the last 13 years, and I have 3. Yes, sir. I'm a practicing hospitalist physician for the last 13 years. I currently work at Center Lee Hospital for the last 12 years, and I was in Alabama Hospital for 6 years. I'm a Camden resident since 2007, and I have 3 children currently in Camden public schools. I am a product of public school education, and I strongly believe in public school education. Because my husband and I were discussing what we would do in the upcoming year, I decided that I would try to share information regarding the current situation regarding the coronavirus. I would like to first tell you about a little bit about the coronavirus. In this area, we really didn't experience it until the middle of March. When this started in the Centera system, most of us were very fearful of not only infecting ourselves, but bringing it home to our families. And I know that this is something that is in the minds of the local Camden residents. First, I wanted to say that the coronavirus is not the flu. One of the reasons, and that was one of the first things that I was looking into. I wanted to say that the flu has a lower mortality, meaning the death rate is maybe 1 in 1,000, whereas the coronavirus is up to 1 in 3 in 100. It's much more contagious than the flu. Up to 3 to 4 adults who have the flu, are exposed to coronavirus, can be infected. We've learned a little something about the infection rate as well. The other thing is the flu lasts about a week, whereas the coronavirus can last 2 to 3 weeks and can potentially have permanent harm and damage to the body. We don't understand this very well, and we don't have the data for this material. I do want to say that there are 2 viruses that are also known as the coronaviruses, which thankfully did not make it to our shore. That was the MERS and the SARS, and these are much more lethal diseases. Up to 35% to 10% of these individuals who came across this disease succumbed to this illness. We're much more fortunate in that. I wanted to talk about safety in schools, in planning, and that's why I wanted for us to understand how this virus spreads. Mostly, it's from asymptomatic carriers. Over 40% of people who have this disease do not know that they have this disease. In addition, when someone is most virulent or contagious, they are not symptomatic. So it takes about 5 to 14 days to show symptoms, at which time the individual who's infected has already spread it to many others. And that's why up to 3 to 4 people one person can spread this virus to 3 to 4 people. But the good news is that this Centera has been on a continuous steep learning curve, and we've learned at least how to reduce this infection and spread. Unfortunately, herd immunity is not something that we'll be seeing soon, because it takes at least 50% of the population to have herd immunity, and so far it's about 2 or 3%. And the other thing that makes it hard to identify this infection is the symptoms that someone presents are very low. It can be from scratchy throat, the pain, the diarrhea, to chest tightness, to no symptoms. So we really don't always know how someone's going to present. The most common symptoms are cough, fever, and aches. That's a big thing. Working in the hospital, we're really fortunate to realize that over 84% of people do not get hospitalized. But unfortunately, 15% of people will be hospitalized, and a quarter will end up in the ICU. And we don't really have a lot of treatments that actually cure the illness, but just treat the symptoms. And steroids, remdesivir, convalescent plasma, we've used that in the hospital, but they have strict criteria for use. But we have seen good survival benefit with these The other thing I wanted to emphasize is that death is something that we mark, and hospitalization is something that we mark. But one thing that we're learning is that there may be permanent harm and damage, and that was of a concern to me when I recognized that there might be permanent damage to my children should they contract this disease. And this was weighing heavily on me. But we do not know how many permanent illnesses are going to be dead. So we don't understand. So the permanent disability that someone might get from this infection is unknown. I wanted to talk about how contagious disease is compared to other infections, such as measles. Measles can spread about 11 to 18 people per one person. Ebola can spread to 2, the flu can spread to 1. So, and this can spread to 2 or 3 of the plague. Although our children will be in the local area, we have a lot of multi-generational homes. Their grandparents grandchildren. The susceptibility of this disease based on age and hospitalization goes up as we age. Anyone who is over 80 years of age has a 15% chance of being hospitalized. Again, I see likelihood is much higher. I did want to talk about things that predispose us to this disease that we don't talk about: hypertension, obesity, and cardiovascular disease. Obesity is not being talked about, unfortunately, in Americans. 50% of us are morbidly obese, and this is a risk factor for not only being hospitalized, but death. And I was trying to find the data in Camden about obesity, but I could not find that. And children who are obese can also succumb to this illness. Fortunately, children do not get hospitalized. Less than 1.5% get hospitalized with their contact infection, and mostly infants are mostly susceptible. I wanted to talk about how this illness spreads. Mostly it spreads through our nose, our mouths, or our eyes. And the main method of spreading is through air. Not contact, but air. So when someone talks, when someone sings, when someone speaks loudly, we spread particles in the air that can be in the air for up to 2 to 4 hours. And these can settle on surfaces that we touch, where we can be infected, and when we touch our eyes or our nose. That is why the recommendation for masking is so successful, because masking not only prevents us from inhaling these particles, but it also prevents us from touching our mouth and our nose. And so it's important that we recognize this. The other thing that I found that was interesting is it can also enter our eyes. We have receptors in our eyes. And so I would suggest that maybe wearing face shields and goggles might protect us from infecting ourselves through our eyes. I did receive some concerns regarding touching surfaces. There have been some studies where the coronavirus can be found on solid surfaces. 72 hours for plastic and metals, 24 hours for cardboard, which can be extrapolated for paper, and about 3 hours for copper. That being said, contact from this infection is less than airborne. And I do know that the teachers are a little bit concerned about using papers. These papers, I think if they're really concerned, they can use them in paper special water for 24 hours before they deal with them. But honestly, paper is pretty safe if you use it for 4 hours and the virus dies out in water. Heat can kill it, and thankfully, so can soap and water. Soap and water breaks down the virus fat layer around it, and renders it ineffectual. That's why soap and water and washing your hands is so effective. So, why should we mandate universal masking? Well, first of all, it reduces the reproductive rate of this virus, less than R naught of 1. What does that mean? Is that less than 1 person can spread to less than 1 person if we use masking. There have been studies modeling that show that if we were having more than at least 50% of the population on masking, we would eradicate this virus without a vaccine within 2 to 3 months. And I, for one, would like to get back to life as normal. And again, why is masking important? Because 40% of people who have this virus do not even know that they have it. And that's one of the reasons. In fact, also, most people, you've seen data about wearing masks to protect others. I'd like to talk a little bit about face shields. We should consider mandating if we open up, wearing some sort of eye protection, goggles or face shield, because that does reduce infection rate. We touch our faces no less than 20 times an hour, and therefore, if we touch a contaminated surface and touch our eyes or nose, we can get infected. I do believe that we in the hospital have mandated wearing face shields for everyone in the hospital. I think that should be considered if we open up for everyone. Also, since there are people who work in this community, in the school district, who may have pre-existing conditions, and so as not to identify them, I think if we mandated eye-wearing protection, that would also reduce their risk and not stigmatize them. So, I've been keeping up at night trying to figure out what's safe. What's our data looking like? It keeps changing. This information is what I got from the North Carolina Health Department. This is data from the whole state of North Carolina. But unfortunately, this disease is a very local disease. But as you can see, one of the trends is the people who are most likely getting this disease are in the age range of 25 to 49. That is the age range of most of our parents. So it's really important that we look at that trend. It's actually going up in the state as well. This is the Camden data from yesterday. As you can see, we had a spike in cases after in mid-June. That's after Memorial Day, and then we had another spike in cases in July.
After 4th of July. We noticed that same cases rise about a week or two after an exposure. So, when people start taking whenever they test themselves. Again, in Camden County, 49% of the cases that are tested positive are in the age range of 25 to 49. So this is different from the data that we were first seeing in early March when those who were contracting the disease were older. I want to show you past returns as well. It's similar data, but as you can see, there's a spike in the middle of May, and that was a nursing home outbreak. And context data also seems to be trending up gradually. What I wanted to understand, and I was having a hard time finding, is how to determine when there's a safe opening. There's not a lot of guidance out there. We're all up to our own devices. The one thing that I did find was in the Harvard website, where they were trying to determine what is safe school openings. And they created a case index per 100,000 residents, and in either green, yellow, orange, or red, and that's the average cases per day over an estimated 7 grades. Camden falls at 10.5, and that makes it orange. That means that's a moderate risk opening. However, that's a moderate risk opening if you don't have any social distancing, masking, or reduced concentration of children. As you can see, in our northern neighbors, there's lots of red areas. Norfolk, Park Virginia Beach, and Suffolk are red. That means they have more than 25 cases per 100,000 residents on average per day. And the reason I wanted to share that with you is because a lot of us do commute, do our shopping, travel, have friends and family up there. This is a similar data picture of both North Carolina and Virginia. As you can see in Virginia, the northern Virginia area has reduced their infection rate, but the southeastern Virginia is unfortunately exploding. I worked at Lee. I took a few trips to Prince Sam, and I've been talking to the ER doctors there, and we're seeing extraordinary amount of positive cases, mostly in the 20s and 30s, mostly from going out to partying, beaches, and not socially distancing. This is the website, the Harvard Global Health Institute. this information. They do have extensive information about how to safely open up and recommendations, so I encourage you to look at that. My concern is right now we are on the cusp of being learned almost being low, and the HUD website recommends that we do distance learning should we go into the red zone. I'm hoping we don't. Orange, they said it is a challenge, but can be done. If we limit student density, have some mix of home learning and wear masks and social distancing. Of course, I agree it's the best scenario and yet it can be done. I want to show you some data from the south side of the hospitals in Centera, which include Princess Anne, Centera Obesity, Centera Lee, Centera North General, and Virginia Beach. This is their recent testing as of July 14th. As you can see, before we have an older population, and now it's turning down to 20s, 30s, and 40s. There's different colors of where we're being tested, whether we're being tested in an outpatient setting, in the hospital setting, or urgent cares. This is similar data between March and July. Also in the same Southampton hospitals in Centera. And again, our numbers up in Virginia are going up. This is similar data. If you see the green line, that's hospitalizations, the yellow lines are intermediate care, and the red lines are the ICU hospitalizations. The first line, the liquid line that you see, is Memorial Day. Not much difference after that. Same line as Virginia's second phase opening. Not much difference after that. Third line, purple line, is Virginia's third line. Started getting more cases. And what really took off was about 4th of July and thereafter. We've been having at least 100 positive cases a day. The other number that I wanted you to be aware of as an internal number is that before we do surgical elective cases, we test everybody. And around March, only 0.5% of those were coming back positive, or 1 in 200, now we're getting 1 in 40. So that's about 2.5% caseload up there. So that's a problem. Someone was concerned about if the hospitalization going up. I get emails at least once or twice a week about the numbers and if I'm not work. I get them pretty much every day. Right now we have over 211 patients in the Virginia area, in the Southampton area, who are hospitalized. Unfortunately, I don't have the information from Centera right now. I haven't had the time to reach out to the president. So, what I wanted to talk about is older population factors we got to consider. When we said older population has been affected because of nursing home outbreaks, that really doesn't affect us directly, except for those who work there. What factors should we consider if we do open to close up? If the 7-day average cases go up by 25 per 100,000. We're not there yet, thankfully. And then, how long do we isolate students and teachers who are going to be exposed? And exposures will happen. Unfortunately, I had exposure to this, and I got tested, thankfully I was negative. My colleague, unfortunately, wasn't so lucky. He was taking care of a patient who had no symptoms and was just getting routinely checked out and tested positive, and that's how he contracted it. So it's very important that we wear masks. It's easy to get careless, and it's really hard to wear masks for 10, 12, 14-hour days. So we should at least isolate people who've been exposed, keep them home until 3 days when they stop having symptoms, and 10 days from the first symptoms or 2 negative tests. That's the recommendation right now from the CDC. If there's a positive test of COVID, someone can come back in 10 days after the last positive test. And see if they've had 2 negative tests. So that's one of those things, how do we bring people back? And teachers will go out, staff will go out. You should plan for this. Yes?
Laws numbers. Their total patient positives have been 213, ER outpatient 148.
Okay, thank you.
And then admitted to the hospital, they've had 65, but currently hospitalized, they have 6 with 2 suspected.
So thank you. Because things are COVID testing is taking longer. Well, it used to take a day or two. Now it's taking longer, and people are having longer wait times as well. Priority has been getting to healthcare and first responders, as you can understand. The other thing about high school students, children above 10 are more likely to spread the disease. The younger children don't spread the disease. We don't understand why, but children under 10 are less contagious to others. We think that maybe children's immunity is a T-cell immunity at that age. There's also a possibility that my concern, like I said, is permanent damage, or those children are 90% asymptomatic, and less than 1 or 2% get hospitalized. There is possibility of permanent damage. There has been this rare but life-threatening illness that happens after someone has an infection. It's called multi-systemic inflammatory syndrome. That can cause hospitalizations, but fortunately we do have treatments for this. Steroids and treatments for COVID, we use oxygen, remdesivir, steroids, compromised plasma. All of these things have certain criteria for use, but they do work. So I just wanted to say, we need to enforce the distancing and masking. Highly encourage teachers maybe to consider wearing eye protection. Recognize risk factors. And then where we've had nursing staff positions and people get infected, is actually in the break rooms. When you get your guard down, you take off your mask, you have your lunch, you have your break. Because, you can't be going all day long without eating or drinking. And that's when we've had the most risks. So we've got to, if we open up, let our children, they can't get out of their seats if they eat, because you've got your mask down, and that's when you're most likely to get that disease. And even if you're exposed to someone who has the disease, if their mask and your mask, there's chances that you're going to get it. We also need to make sure that we keep the teachers separated and classes separated, so that if someone does have an exposure in one class, not everyone goes down, because exposures will happen. We have to plan for that. And we've got to change the culture. Wearing a mask out there was really annoying, but the other day when I got home, I pulled into my driveway, I put on my mask and walked inside the house. So it's becoming second nature. After 3 to 4 months of wearing a mask every day, it becomes second nature. You forget about it. So we've got to model good behavior. And I'd like to just say, like the data said, we are having increased rates of infections, especially in Virginia. It's prudent not to be callous and think that we'll have a problem down here, because it doesn't take very long to get it outbreak. Let's see. And also, we do have a surge plan. We're talking about it at the Bloom and at the General. We're talking about canceling elective surgeries if numbers go up. And that we did initially, but we're back on track again. We are actually getting too full, and people are waiting in the nursing room for up to a day to get a bed. And so our numbers are going up. And in a local area where we have Centennial Avenue, if you need more critical care, you'll be transported up to Virginia. That is our fee. We accept all patients from here. And if we're busy and full, there's no place for secondary patients to come up to Virginia. I just like to say, COVID is real. It's a pain. We should wear masks and we can get rid of this. Lack of belief of this illness does not make it go away. And again, you should watch out for younger people in their 20s and 40s, and try to practice good behavior when you go out. That's it. So again, I'm just giving you this information. But I really wanted to know the data for children and COVID, and I think I went over some of this. We all know they spread the disease, they actually get the disease from other people, and they often have asymptomatic or mild illnesses less than 90%. There is some data that they tested about 150,000 human cases in April. Only 2,500 were positive at the age of 18, that's 1.7%. And 15% of the children who were hospitalized were under the age of 1, although the under 1 population represents 1.1% of the population. So hospitalizations in children are rare, but infants are more at risk. Older children can spread the disease. Younger children have asymptomatic causes, so you don't know if they're sick. And we just have to be careful. I'm not fully done opening up. I just have to think that we should look at the local numbers and have and if we open up, we should have a plan in case the numbers in the local community go up to close the schools. That is something we have to keep an eye. I, for one, would love to see my children have some education in person. I'm not an educator. That's it.
Thank you, Doctor. Anybody have any questions for Doctor?
I do. Thank you for coming, first of all.
Thank you.
I know you're a busy person, and it takes a lot to you put together a pretty comprehensive presentation. I try to be an optimist and a realist. And to me, there's something mentioned in here as far as the local disbelief of COVID severity. Could you maybe shed some light on why some of the deaths that are contributed to COVID, we all hear stories about somebody dying in a motorcycle accident who tested positive, or somebody who was stage 4 cancer that tested positive, and that death was contributed to COVID. Could you shed some light on that?
So, I don't know if someone in a motorcycle tested positive. That might be just the behavior patterns. Someone who might have had cancer may have immunocompromised state. They may have increased risk of getting all sorts of infection. If you don't know anyone personally who's had it or been exposed to it, it's really hard to believe. Even in February, I thought this was a Chinese virus. I mean, I didn't think we'd see it on our shores, or it was going to be something in New York and it would go away. Even as medical professionals, we didn't really believe this until we started seeing the numbers. I think it's just hard to have a belief in something that you can't really touch or see. You can't see the virus. You don't know the virus. You see all this stuff on TV, and you don't see it around you until it does affect you. And of course, no one would, in their right mind, would close schools, businesses, or any of this and change your life just because of nothing. And actually, the numbers, before we came down, there were some other computer modelings, and from coming out of Europe, they were thinking that up to 2.5 million Americans would die from this illness if we didn't do anything about it. So I do think we've done something about it. I just think that we haven't kept it under control. Maybe we didn't do something severe enough. In other countries, people have mask-wearing cultures. They believe the government. There's a lot of disbelief in the government. Nobody really knows. We've not done a really good job as a country having a single messaging. There's been lots of different messaging, and this was really difficult to get put together because there was no one single source that I trusted. I think in other countries they have a more nationalized healthcare system, and there's one messaging. We don't have that in this country. There's small local communities, states. And so the messaging has been very mixed, and the reception is confused. If one person says this and the other person says that, who do you believe? So the messaging has been not stable, and it's hard to believe anyone. Even as a provider, I don't believe everything I hear. I check the sources. So I can understand why people are confused. They don't know who to believe. They've had too many different stories, and it's real. We got to deal with it.
I have had some actual extended family who have had COVID. Thankfully survived without any issues, and they're older. But are going to be hesitant or more unwilling to send their child to school with a mask on. So I'm wondering if you could maybe speak some to mask hygiene.
Yeah.
I'm a dentist. I wear a mask all day long. I try to get my hands on as many N95s for my staff as I can. But something I noticed, because when you're in dental school, they drill infection control into your head as much as they do how to restore someone's mouth. People are constantly touching their mask with their hands, touching their nose with their hands, lifting their mask up to take a drink or eat or whatever. And I worry that the lack of hand hygiene along with mask wearing is not going to slow anything down. Ill-fitting masks that don't conform to your face, your eyes, still allow an air in. We know the gold standards in N95. Those are not available to everyone at all. It's very hard to get. Me personally, here's a skeptic in me, is that COVID can live on a piece of cardboard or paper, but yet it doesn't live on a cloth mask. A cloth mask which we breathe warm, condensated air into. So I think it's personally safer to wear a multi-layered surgical mask if you can get your hands on.
You can't contaminate yourself. We have had one patient who actually wore his wife's mask and ended up with COVID. So it is possible. But it's also the inside that's, the outside that's contaminated, and it really, again, it does protect others from, if you're sick, from getting the infection, and it protects you if from protecting. But yeah, I agree that's a problem. It's a learning curve. But a mask is the one thing that we have out there that's going to reduce our infection rate. And I did want to highlight one other thing is we have less, people who wear masks have less serious infections because they don't get as much virus. So the more virus your body's exposed to, the sicker you're going to be, and the more likely you're going to be hospitalized. So it's not ideal, especially for children. Adults have a hard time. It's just something we're going to have to get used to for the next couple of weeks to months. It's the only thing we've got right now.
Is more concern of taking it home?
I do believe that our children are relatively safe. If they get it, they're most likely to get it from their parents and then spread it to each other and then take it home with them. Again, most children have asymptomatic cases unless they have other health issues, such as immunosuppression, respiratory illness, obesity. So yes, I do think most of our children, that's not to say everyone's safe. In Currituck, I think it's about 7% who are under 18. I read some other statistics. I think in Virginia Beach, it's 6 or 7% under 18. So they are positive. They just don't have severe illnesses. There are, but not locally. Correct.
They all need to have underlying health condition.
But again, from what I've seen on the news, and that's not local, is infants. There's been infants that we've seen, and they're more likely to 15% of infants. So if you have someone who's under 1 in the household, that's the risk. Because they get hospitalized and their immune system is not robust yet, so that's why infants get hospitalized and are susceptible to this infection. So no, locally we haven't seen it. There have been some nationally, and one thing I did note is that weight was an issue, obesity,
In children.
in children. So if there are respiratory illnesses, obesity, or any immunosuppressant, I may consider recommending they opt out of in-person school.
something that may make parents draw some comparison. I know it's, like you said, this is not the flu, but the flu does kill, on average, well, a range,
About 6,000.
37 to 187 children per year. 187 was the record in 2017. So, you know, in comparison, it makes me feel better as a parent to know that if my child catches COVID, they're less likely to die from that than they would the flu. Thank you.
Dr. Mitra, we're 2-3 months behind China, Europe, Italy. When they had their big surge in the beginning, they're kind of on the downward trend. Reports coming out of Italy, I'm sure you've probably heard it or familiar with it, is it appears that the cases they're getting now are weaker. They're not as bad. They're not hospitalizing for as long or as bad as it was during the initial outbreak. Are the cases that you're seeing now in July versus March and February any better, any worse?
I think they're about the same, but I think what happened in earlier in Italy is their healthcare providers didn't have PPE. The hospitals were overrun, so they couldn't give the care that they needed to the patients that were coming through. So, you know, we've all heard flatten the curve, and what that means is to try to reduce the number of COVID infections at one time so that the hospital system could manage. What happened in Italy is the hospital system couldn't manage. And so that's why mortality or death rates went up, because there just wasn't nurses and doctors and healthcare providers were getting sick. They didn't have enough protection masks. And the hospitals were running out of space. They didn't have any medicine, so the mortality was higher in those cases. And also we're learning. This is something that we're dealing with for a little over 4 months in this area. And so we're learning how to better treat it, what we should or shouldn't do, what criteria we should or shouldn't use. So I think our mortality here is going down because we're learning better and we know how to manage it better. But should we go over and should our hospital system get overwhelmed, we're going to see people dying unnecessarily.
Do you have any concern the vaccine is promising? I myself am not going to take a brand new vaccine. How do you feel as far as this virus mutating and then the vaccines that come out possibly not effective? And the reason I'm asking that question is not so much to put you on the spot. It's just, you know, when the safe reopening of our schools is possibly dependent on a vaccine, I'm wondering how that will play.
So the virus mutating isn't really, I don't know, there's different data out there, but the mutation is really more on the outside. I don't know if it's more infective or not, but at least the lethality, I think, is not attributed to the mutation. But we don't know this. Do I feel safe getting it? Well, I, for one, will get the vaccine as soon as it comes out. Because if I do get an illness, it's going to be minor. But I don't think, you know, there's 3 or 4 different ways of they're treating the vaccine, and so it depends on what type of vaccine we're getting. So there's hundreds of labs working on it. So it depends on the individual vaccine that we come out with. I will study that before I take it. But I will get the vaccine just because I'm in a high-risk profession, and so are you. And, you know, we need to get herd immunity, and that's going to take 50% of our population before we can knock this infection down. And right now, all we've got is social distancing and masking and hand hygiene. And maybe we should institute a required hand washing, you know, every other hour or every hour, because thankfully soap and water kills this thing.
Any other questions?
Thank you for coming tonight. Thank you very much.
Thank you.
Thank you.
No. It's going in, I can't figure it out. It is being broadcast out. I don't know why it's going in and out. I get crystal clear coming from the microphone. There's a hitch somewhere to give you.
Do you need a moment to reset or reboot your cookies or anything? Or?
They said it's better now. That was the last one that I got. There's about a 10 to 15 second delay, so I make an adjustment. It's about a 15 second delay before it gets out through the server. So I think we're better. I think.
You need a few extra minutes?
Can we do that?
Yeah.
Can we do a 5-minute reset?
Yes, sir.
That would be great.
Yes, sir. So we're going to take a 5-minute break.
Is it off?
Wi-Fi. That might be the problem. Well, not hardware. Video don't go so good over Wi-Fi. Unless you got a really good router.
I could, but it would be a very crude attempt.
Oh, my Lord, don't say that.
Yours was without this most part.
You got the sense.
Slow.
it's not. I know it's not working. The crazy thing is, crystal clear audio.
Is what you're hearing.
Yeah. So we're good. Yeah, I think so. Everybody says it's better than it was. I ain't touching a thing.
Is it your headphones? Because she just said that alone.
See, it's a delay in.
Dr. Farrell, you have some updates for our reentry plan?
Yes, I do. So, first of all, thank you to Dr. Mitra for sharing the information from a medical perspective. I would like to share some information with you tonight from a management perspective. And I'm going to do a little bit of reading because there's a lot that I want to share, and I don't want to miss anything. I would like to share some information from a management perspective, as I said. I want to be clear first about some things pertaining to plans B and C. I didn't include Plan A because at this point it is not currently an option with the governor's mandate. Plan B is a combination of remote and in-person instruction with a student capacity of around 50%, depending on the size of the classrooms in the school. It requires social distancing, face coverings, temperature checks, decreased numbers of students on buses, lunches eaten in classrooms, students remaining in one classroom most, if not all, of the day, few to no visitors in the building, an assignment to group A or B, in-person instruction 2 days per week maximum, and quite a few other details or things to work out. Plan B has presented school officials both in Camden and other places with a number of questions. Some of those questions have answers. Some of those do not have answers yet, but will at some point, and some of those, quite frankly, are just unanswerable at this time. Plan C is 100% remote learning. Let me say two things up front about remote learning at the end of the 2019-2020 school year. The first, and I think most importantly, our teachers were thrust into remote learning when the governor decided on a Saturday to close schools. And from my view, did the very best they could given the circumstances. So for any of our teachers who are out there listening, kudos to you. The second thing I will say in reference to remote learning at the end of last school year is this. We have room for improvement where future remote learning is concerned, and I think we all accept that. We've had a re-entry team in place led by Mr. Mazzell, our middle school principal. They have been working since late spring to come up with details for implementing plans A, B, and C so that we were somewhat close to being ready to implement whichever of those the governor decided would be the way we open the new school year. We have also had a remote learning team in place led by our Chief Academic Officer, Yolanda Anderson, to plan for any remote days that we might have in our calendar for plans A, B, or C. Because we were going to have some remote days, as few as 5, no matter what plan the governor decided. And of course, with Plan C, every day would be remote. As you know, the governor mandated that at a minimum, school systems start school on Plan B with the local option to start on Plan C. And at this time, again, Plan A is not an option. Like all other North Carolina school systems, we then started thinking about the details of implementing the bigger picture Plan B, which had already been worked on by Mr. Mazzell and his team and Ms. Anderson and hers. One of the first steps was to look at the survey results. We had those results from both families and staff. Without going into deep detail about the survey results, which you all have seen and reviewed, our families and staff are divided on the way we return to school in August. The survey to families included asking if they preferred Plan A, B, or C, because it was sent out prior to the governor's decision. I'll also say that we had really good response rates with both of these surveys, so thank you to our families and our staff for that. The majority of families chose Plan A when they had Plan A, B, or C to choose from. The staff results were also split, with 46.3% choosing Plan B and 53.7% choosing Plan C. The staff the staff survey also allowed for comments. As I read through the comments, and there were close to 150 of those, I quickly realized that a lot of staff members had these same questions that we have been grappling with all summer. Examples of those questions include things like, how do you transport students with social distancing on a bus with the number of buses we have? How do we feed students? How do we mark buildings for social distancing? And the list just kind of went on and on. As I said, close to 150 comments. I decided at that point to categorize the questions, and as I did so, they started to remind me, and those educators, those of you who are educators in the room will really get this, remind me of Maslow's hierarchy of needs. The simple way to explain that hierarchy is this. It's a pyramid. At the top of the pyramid is a place where people, in our case students, reach their full potential. The layers of the pyramid below the top layer of other needs that must be in place for that full potential to be reached. Things like esteem, belongingness, security, safety, with the bottom layer being basic needs like clothing, shelter, and food. The idea is that if all of those layers are not in place and the basic needs met first, the other layers will not happen and the full potential will not be met. So I put Plan B at the top of the pyramid and organized the questions, and there were many, into those layers below Plan B being at full implementation. The bottom layer questions really have to be answered before any of the other layers can be answered, and certainly before I can comfortably say to this board and to our parents and our staff, and most importantly to our students, that we can reach our full potential, which in this case is the implementation of Plan B. To share a few of the bottom layer questions, let me give you a few of those. The first one is, do we have enough buses to transport students to and from school and meet the guidelines that are in place for safety? We have 21 buses in our school system with an average of 22 seats per bus for a total of 462 seats. We typically transport around 975 students each day. The answer to that lower layer question then would be no, we do not have enough buses to transport students to and from school. Another example is, do we have enough square footage in our classrooms to follow the guidelines and meet the 50% maximum capacity requirement? Some of our principals have set up their largest classrooms. There's one here in this building that the state has set up in each of the schools to meet the requirements. And the average is 11 or 12 desks for students, of one per desk, in a classroom at 3 of our schools. Grady Primary School could possibly make it work with some planning due to their class sizes being smaller, but there's some hesitation in whether or not we can be ready for that by August. Camden County High School can also fit 9 in the majority of the classrooms, and while that meets the social distancing requirement, it does not meet the 50% requirement, 50% maximum capacity requirement, because most of our classes have far more than 18 students. So you have 9 on an A day and 9 on a B day, but if Ms. Davis has 28 students scheduled in that room, she sort of needs a C day in order to make that happen. A third, and the final one that I will share with you is, will we have the manpower to operate the school as COVID positive, COVID exposure, and COVID symptoms cases cause us to have to follow the quarantine requirements of the health department and the CDC and so forth. And I'll be very honest with you and tell you that this is my biggest concern. An example that I would give you is this. Let's say that we have face-to-face instruction at, say, Brandy Primary School. And there are 8 or 9 first grade teachers. And they have a team meeting, or not. They have passing each other in the hallways, talking at lunch, or whatever the case may be. A student in one of those classrooms tests positive, or a teacher. So let's say the teacher tests positive. The teacher tests positive. Currently, the quarantine guidelines would mean that teacher has to self-quarantine. All of the other people in touch with that teacher that day also have to self-quarantine until they test negative. So suddenly your first grade teaching team is wiped out. And the question for us becomes, who teaches the first grade students? And if the principal came down and asked the teacher a question that day, or whatever the case may be, then the principal is also. And so you see how it suddenly grows. So the answer to that in the beginning could be yes, we do. But it could quickly become no. We have had this summer without students in the building, we have had as many as 5 staff members at a time in different buildings quarantined because of contact. We do not have anyone who's tested positive, but because of the contact. And that is simply talking about teachers. We also have concerns about staffing the buses and cafeterias and so forth. There were many more lower layer questions, but I think you all see my point here. Thinking back to the hierarchy pyramid and the categorized questions, if we cannot answer those lower layer types of questions, or if the answer is no to those questions, then there is no need in some aspects to even address the layers above, because we can't meet the basics in order to make that happen. So given this information, as the superintendent who reports directly to the 5 of you, I have to let you know that I do not believe we can implement Plan B at this time. My recommendation to you is that we start school on Plan C, 100% remote learning for students, with our staff coming into the buildings and practicing the social distancing that is required, and that we do that so that they can make remote learning more meaningful, they have access to the things that they need, and so forth in order to instruct our students remotely. And that we do that for the first 9 weeks grading period and begin working on getting some of the answers to the questions and some of the guidance that we hope will come at some point for the possibility of moving to Plan B after the first 9 weeks grading period. This would also allow us to start tomorrow working on funneling all of our resources and thinking toward making sure that remote learning is in place that will allow our students the best education possible. I also did not do this in the beginning, but I want to say a huge thank you to our 5 principals. They are all here tonight, and they have all said that they would be willing to answer any questions that you have. I told them that you all would be kind to them, and they do that anyway. And of course, I will ask any or take any questions that you have. But that's my update on where we are.
I guess I got a question for you, Dr. Krill. If logistically, it seems impossible for us to implement Plan B now, what might change in 9 weeks that's going to make it logistically possible as far as the buses and if B is our only option?
So we are waiting on guidance for a number of things that we have not gotten. I have read multiple plans about, since you mentioned transportation, where school systems have said we will provide transportation and we will implement social distancing on the buses with 1 student per seat. I do not know how they're going to do that, and I do not know how we're going to do that, because as I said, some of these questions are unanswerable when buses are about $100,000 per bus, and we need 22 or 23 more buses in order to make that happen. So I'm not sure that that's going to be answerable at any point.
You said our average transportation is $9.75 a day. That's only regular school day, or is that already cut in half?
That is the number that transportation gave me for a regular school day.
So if we had already cut everybody in half, we'd really be looking realistically at 460, 470 a day, which is much closer to what we can do with 21 buses and 22 seats.
Yes.
So we may not be that far off on that particular thing.
Where buses are concerned. We do not yet know where we are, where drivers are concerned, just because of risk factors that may cause our drivers not to feel comfortable being on the bus.
Was it in the order that you only have practice social distancing on the bus and they can mask could not be worn by students, so you could put 2 students to a seat unless a mask was not worn, and then you get to spread them out 6 feet?
The only guidance that I've seen that's anything other than 1 student per seat is if they're siblings from the same household, and they could both sit on the seat together with a mask on.
Is there anything in the recommendations for physical barriers versus social distancing? In other words, I know Randy and some of the lower grades, they do a lot of the 4 square desks together, so they're each, has a little group of 4 and a group of 4, group of 4. If they were to construct something, I've seen it a couple of times around the internet past day or two, PVC piping and vinyl shower curtain or something, so we're creating physical distance versus social distance. Is there anything in order that we could increase that capacity if we have actual physical separation between students?
I've not seen that.
No.
The only
we can follow
physical barrier that I've seen really has been about offices and with the plexiglass and things like that. The cafeteria.
Check out, touch points like that. But if we can, a lot of the comments from the teachers, and thank you all very much for the ones that are listening. They were very detailed, very thorough, and very to the point, and that's nice because it actually gave us a good idea of what you were actually thinking. Was about the experience for the children coming back under Plan B. They can't see their friends' faces. They can't talk. I'm along some of the same lines as Kevin is about what's going to be different in 9 weeks if we don't have what we don't have, what we don't need. Versus, are we looking at creative solutions like that? Let's physically distance versus socially distance. What are we thinking outside of the box to make this happen? Because we can't. I don't think anybody's looking for remote learning the entire year, but I don't know how much is going to change in 9 weeks or even 18 weeks. Funding-wise, transportation cost-wise, to give us all these extra things we're looking for that we need to implement.
I have no idea what's going to be different 9 weeks from now. I do anticipate guidance, more guidance. I certainly hope that will happen. I know that 9 weeks is a lot more than 4, or fewer for the early college to get ready with the late announcements. So there's planning that can go into that. Our thinking has been that the first thing we would do if we were to go to Plan C would be to work, again, all of our resources toward remote learning to make sure that our students are ready, our teachers are ready to instruct our students on the first day. That would be the first thing. And then once that happens, then we have more time to try to get some of this guidance, try to answer some of these questions. I will say very honestly, I think that some of those questions that are unanswerable now will be unanswerable in 9 weeks. Because some of those things there just aren't answers to.
Amber, I see you shaking your head. What are your main concerns?
I think our main concern is the amount of time to make Plan B work. I want my kids back in my building I would say more than anybody here, but as much as anybody in here. You will never replace face-to-face learning, in my opinion, and I do not think remote instruction is the answer at all. And I will go to my deathbed saying that, so I want the kids back. My concern is in 3 weeks to make the guidelines we've been given by the state work. I can only speak from my level at the high school, but when you take a high school schedule where you change classes 4 times a day, and you have to make that work and keep people, even if you cut us in half. So I have 225 kids here, and keep them 6 feet away from each other. And, aside from my personal belief about what I believe, I have to be in compliance. That's my job, is that I'm in compliance with what the state has told us to do. And to do that, then I have to, in the classroom, in the hallways, and those things, I have to keep them 6 feet apart from each other. And that means changing my entire schedule. That means changing my teachers' entire schedule. That means changing everything that we do at the high school level, and doing that in 3 weeks. And that means telling my teachers, here's a whole new thing you have to do in 3 weeks. I'll be honest with you, I don't know that it can be done in 3 weeks. If I have to do it, I'll do it, I guess, because it's my job and that's what I have to do. But I really, really worry about it being done well, and how to do it in 3 weeks. Like Dr. Farrell said, I know there'll be some things that there won't be answers for in 9 weeks, but I do believe 9 weeks will give us a chance to do our best job to make it happen and to do it well. I don't want this to go on forever. I don't want it to go past 9 weeks at all. But my fear is we can't, my school can't make it happen the way it needs to, with the guidance and the requirements we've been given by the state. If I could have the kids come in and just be careful and wash hands and keep them as far apart as I could, or put up plexiglass barriers and make it work, I would. But like I said, I'm looking at about 9 to 11 per classroom. And I don't even know how to make that work with my numbers. And I've got to set up completely different cohorts I'm talking about a certain number these days and a certain number these days. So it changes everything for us. So that's my biggest concern is the time frame to make all of that happen with that.
Is it reasonable to think that doing the best we can?
Mm-hmm. But still, after 9 weeks, some of these rules that we have to live with are going to be next to impossible.
It's going to be tough. I'm not going to lie. It's going to be really tough. But we can make it happen in 9 weeks. I don't know if I can make it happen in 3 weeks. It's my concern. I just don't know, because, Mr. Reed, my assistant principal, we've already started digging in and looking at scheduling and how we can change it and what we can do. We've got some ideas and there's some things we're really working on to do that. But I just don't think it's fair to my students or my teachers to throw something together, because whatever schedule we make, that's their schedule for this semester. We can't just all of a sudden, and 3 more weeks after that, change it and do that. So whatever they get when they come back, we've got to make sure it works. So that's why we really want to make sure that we have the time to implement it and make sure it's what needs to happen. Also, I think it's important, I can't remember who said it, but they're right. Dr. Farrell was right. When they went home on a Friday and Saturday, it was. I mean, we will all admit remote learning in the spring was not at the top of our game, because we were all struggling to make things happen. And there are already things, I think every school in the district has been working really hard to make sure that if we have to do remote learning, or what type of remote learning we have to do in the fall, it's very different than what happened in the spring. And I think that's important to all of us. But like I said, just the time crunch, I think, is the hardest thing, because while there may not be answers, I think there's a lot of answers that would be out there if we had the time to work on them.
One question, what I mean, the more time thing was, if one of the biggest problems is space. We're already overcrowded. We know this, that's why we need to go to school, because we have no space as it is. So space is the problem, that combined with social distancing. I mean, in 9 weeks, unless we're building more buildings, space is going to be still a tough thing to solve, right? I mean, it seems to me the only solution we have is to seek a waiver to get around the social distancing from the governor, or he'll relax that some. And it seems like that's what's causing the biggest problem, is the lack of space.
Yeah, him relaxing that would actually help a lot. But in lieu of that, you know, what we're looking at is, can we make cohorts of like teams? So I'm not having to move 200 kids at one time. If I can, you know, put cohorts of kids in classes, so where you're looking at having like a section of these are mainly freshman classes that I can put together and have cohorts. And are there certain electives that mainly freshmen are in? And we can look at doing that instead of ringing a bell and 225 kids move all at one time. Can we move sections at one time, or we can control how much distance and time? And those are all things that are feasible and that I think can be done, but it's going to take time to do that. And I don't know that we can do it in 3 weeks, because we do have to completely look at our schedule and forming those cohorts. So that's kind of where I think the time frame would help us do that.
I think the time frame, it's still possible that with all your work and all your effort, there still may not be enough space.
Well, yeah, I can't sit here and promise you anything, you know, and we are looking at, you know, other spaces that we can use. I mean, we'll probably end up using this room, we'll probably end up using a science lab as a classroom. I mean, we're gonna have to get creative with things. You know, I've already told my teachers, but you may not be in your traditional classroom. We're gonna use our larger classrooms for our larger classes. I mean, we're gonna have to be creative, and high school's gonna look a lot different this year than it's ever looked.
Rough guess percentage, 12 weeks from now, where do you think you'll be? As far as, will you be be ready to make it work in 12 weeks? Honest opinion, rough guess. 60%, 70, 80, 90? But unfortunately, because the five of us are on the spot to make this decision, so I want yours, because y'all are the experts. You want honest opinion.
Yeah, I can make it work.
Okay. The other four of the five of you, Ms. Stevens.
My area is so much smaller. And to go by these sidelines, I'm still working with mistakes.
How large are those rooms and those trailers?
So,
How large are those rooms and the trailers? Not very.
I can get 10, maybe 11 students. My problem is I don't have one hall. And I don't have but one teacher per subject.
And I'll go back too. A lot of it depends on, we've talked about this too, you know, we've got to look at how many students go with that 100% remote instruction. You know, if we have teachers pulled, I mean, all those things, I mean, there are a lot of variables. So I'm going to go 75%. I'm not a good gambler, guys, so I'm going to go 75 and then leave it to y'all. Sorry. Yes.
So I will say that on paper, like, it looks really good that CIS could pull this off, but I spent an hour today speaking with one of my teachers who is really having a hard time about coming back. I mean, I've had 2 conversations just today with just teachers with their concerns, one with her own personal health and the other one with her children. And so when I think about, thank you for being here tonight and just giving us that reassurance about our students. I am really concerned about the adults in my building. We have the space, like, we've scheduled it, I have them split up, I think I know how they're gonna move. I'm very nervous about kids coming in the mornings. I've worked with Mr. Lazar and Lisa in terms of how are we going to get our kids off of the bus and in 2 separate buildings in the morning, in terms of like manpower, in terms of being able to, you know, have a set of adults at the buses and then another set of adults with the cars, and that process and how long that's going to take. And so my concerns are more so with the logistics of it than with like having to worry about a schedule. Now, I am really concerned about the remote learning part because ultimately, several of my teachers, two of my teachers, one of my teachers is going to have to do remote learning, right? Remote teaching. And so, take for instance, my fourth grade are coming up from Grandy, and I have 25 kids per class. So if I have to pull one of my fourth grade teachers to do remote, where are those 25 kids going to go? Now suddenly I have an issue with space. And so those are some of my concerns.
This is a normal seat. I share some of the same concerns as the other principals. I would have to revamp my schedule as well, depending on who comes on in the A group and the B group. With electives, my electives, I have to do them in the morning, so it's a lot of variables with scheduling. I am concerned about the morning time, how long that's going to take. You have to take the temperature, you have to ask the questions to each kid. And on the bus, how does that work? And when they get off the bus, got to do the same thing with them. I do have concerns with my teachers as well. I do have some teachers who are concerned about their own health. And it's just, could I make it work in 12 weeks? I will do my best. Will I be ready? Yes. Would I be comfortable in 12 weeks? No, I don't think I'll ever be comfortable with this. I just would rather have my kids back and let's do business as usual. But I would set about like 75% ready in 12 weeks.
As far as, well, let me start by saying our principals met with the cabinet. We all want our kids back. We all know that working with the kids face to face in small groups is going to be better than remote. Of course, I'm going to be specific to Grandy. We think we need that solid foundation early. We don't want to have any gaps increase, so we want them. As far as space, because of our class size law, and most of us are tiny, we could definitely do the space. But some of the logistics, I'm thinking of Ms. Penwell takes the kids to the bathroom. Someone has to go in that bathroom and clean it while her kids are in the hallway, come back out. So manpower of doing everything that is restricted upon us is going to be extremely difficult. And being ready in 12 weeks, the governor could come up 2 weeks and change everything. So the logistics are still going to be an issue 12 weeks, 15 weeks, the entire year. So what we're hoping is, the governor is, I would say, that some of these restrictions are taken away from us and we have more freedom. There's no way a 5-year-old is not going to touch another 5-year-old in my building. There's just no way. So they're going to hug, they're going to high five, they're going to not pay attention and bump into each other. They're going to enjoy their time with a mask. Myself, trying to sit here with the mask is difficult. Everyone who knows me well enough knows it's difficult. So it's the logistics that's a nightmare. But we need more manpower to help.
It's the guidelines that they have set forward for us to go by. This is making it much difficult.
It's not a matter of whether we think kids should be in school or not in school or virtual or otherwise. The list of stuff we've been given by the state is completely unattainable for the most part. I think what we're trying to get around now is it's going to be any different in 12 weeks than it is now, though. It's kind of what we're asking. And you see even within the 5 different schools, the priorities are different. One is space, one is logistics, one is drop-off, one is schedule change in classrooms, and then Brandy is just trying to teach a 5-year-old you can't touch anything. It's not going to work regardless. It's a bad spot that we've been put in from the state. A lot of directing with no direction is
I don't like to make predictions about what other people will do. But the common sense side of me says that one of two things has to happen in 12 weeks, or maybe fewer than 12. Either the governor is going to have to is likely to move everyone to Plan C across the state because it's not obtainable, or some of the restrictions are going to have to be relaxed so that or rethought maybe is a better word than relaxed, so that we can implement these things, because we're not the only ones struggling with the distancing. We're not the only ones struggling with the bus numbers. We're not the only ones. And I know that we have to make, or you all have to make this decision in the best interest of what's going on here. But I talk with other superintendents across the state, and I participate in Zoom meetings, and the struggles are the same everywhere. And there are some systems out there, and I put some calls in today. Right now, superintendents are difficult to reach. But I have put some calls out there today because I did a little research on my own today after one county's plan was pointed out to me, that when I first read it, or when I first saw it and read it, I thought, wow, this looks really great. And then I thought, well, how are they going to do that? That's the same struggle we're having. How are they going to do that? That's the same struggle we're having. Well, how are they going to do that? And it just, there were so many of those. So I reached out to that superintendent because I'd like to hear from that person about how are you going to make this happen? Because I'd like to think that they can make that happen. And I'm pretty optimistic, but I'm not optimistic that they can pull off some of the plans that some school systems have posted online, because I know they don't have double the buses or even 10 more buses sitting around. I know they don't have classrooms that are half the size or double the size that they actually are currently using. So I do think that as school begins in August, I think that we will see some thought or some rethinking where some of these guidelines are concerned. That will allow more of us to move to a plan B. And hopefully we'll see the numbers of COVID cases decline, but that I certainly can't predict either.
Superintendents scheduled a conference call or any sort of mass communication with the governor to address these concerns yet?
Not with the governor. Not that I'm aware of. We had a call this morning that got canceled for some reason, and so we will have the next one will be on Wednesday of next week.
That's what I was kind of getting at with more. What can we really change in 9 weeks with this? I know staff's going to do everything in their power to make it work, but I think ultimately we're going to have to petition the governor to lax some of these ridiculous rules. Basically, what he said is, I'm opening up schools, I'm going to make it impossible. That's what I'm saying. It's virtually impossible. I can't disagree. Somehow we got to, like Elizabeth City sent a waiver up saying, hey, you're killing us. We can't do this anymore. But our utility service, we need to say the same thing. We're a small district. We're already in need of a school. We're working on that. So we're limited in space, so we need to have a way so we can get our kids back in here like you said we could. Because currently the way that you said we could, it's not logistically possible. Seems like there's a lot of contradictions back and forth with the masks and social distancing. I mean, his order for wearing masks was like, you're within 6 foot. Any days we're hanging out all the time, so it's not here. But if you're within 6 foot of somebody, you should have your mask on. And so, if we require people to wear masks, why can't they be close to the 6 foot? So that we can get them in this building.
I mean, to answer to your question, you can. And I mean, I was working with my partner in the same group office too, sitting right there, we both had masks on. That's how I got exposed. But we were both wearing our masks, and I didn't get it. It was probably next week for 20, I don't know, 20, 30 minutes on the computer. Answer is you can't because this is as long as you wear a mask.
Right, but our problem is the governor's directive he's giving us, it doesn't matter. One sentence says within 6 feet, the next one says anywhere in the building. So and that's what we're dealing with.
They're not 6 feet away from everybody.
Right.
I try to take it away from people.
That's what I think is so we can go to the government and say, look, if we mandate masks, our children get closer than 6 foot. And then we can get them in this building, and we can get them, and then logistically things can be, and then also like the over excessive bathroom. I mean, having to clean after every use or whatever that. I mean, we can get it more like reasonable. I think that would There's some guidelines that are more possible to meet than others. If we can figure out what those are, so that we can start attacking those as well, or, not attacking, start, I don't know what the right word is, addressing with the government that this is not doable. This is over. Or,
The recommendation is that we switch to Plan C. Check. The recommendation is that we switch to Plan C for the first 9 weeks.
Given all that we talked about here tonight and the information that I've shared, yes, I think that's what is doable. Ms. Davis. I'm trying to think how to word this correctly. Our number one goal by what we're elected to do is to ensure that the kids have the best education they can. If we implement Plan B now, with all the logistical issues, is the product going to be, with the trade-off, they get some in-person instruction from their teachers, but all the logistical problems we're having, is the end product going to be better or worse than if we do virtual learning for 9 weeks? Because honestly, that's what it all comes down to me on how I'm going to vote. It's what's going to give the kids a better education for that time period. We know in person is better, but just because they're here for 2 days does not necessarily mean that with everything that's going to happen, it's actually going to be a better experience and better learning environment than if we had to send them virtually for the first time.
Okay, so there's two parts that I answer in my opinion. I think face-to-face is always better, and I think any time that they can be face-to-face with the teacher would be better. So I do think seeing a teacher 2 days face-to-face would be better than complete remote instruction, so yes. However, in 3 weeks, I cannot meet the governor's guidelines at this point in time.
Everything has to try and make it happen.
So that's my answer. Do I believe that 2 days face-to-face would be better? Yes, I do. But under the guidelines, in 3 weeks, I cannot make that happen and be compliant under the guidelines at this point. And that's as honest as I can be.
All right, so I've got another topic of conversation that I think it's already been discussed amongst some of you. Mr. Lazar. So, if our effort is to get as many kids face-to-face as possible and live within the guidelines, is it possible to have Grandy Primary K through 3? Our class size is already 18 students per class. I don't know what the breakdown is as far as how many parents have already said they want to do all virtual. But let's just say we've already got it 18 kids, split it in half, got 9 kids on the 8th day and B day. If we focus solely on getting our kids in Grandy Primary back, we've got enough staff because teachers are already there. If we had school nurses from the other 3 schools utilized at Grandy Primary, janitors from the other schools utilized at Grandy Primary while they're under Plan C. Buses with as many parents to drop their kids off at Grandy Primary School. I find it hard to believe that we won't have enough space on buses to transport those kids who are left in that pool. So is that a reasonable, I'm put you on the spot, is this a reasonable possibility? Or what timeline? Well, another district I read earlier has pushed their start date to August 31st. I don't know how they get by with that. But they're starting on August 31st.
I think we're doing
Virtual. So let's just say we did virtual until August 31st. And gave you some time to get your data going and organized and make things work.
The question about the numbers, Ms. Anderson shared with me that there were 63. We have about 540 kids. By that 12% would rather be with the academy. So about 89% would rather choose Plan B, if I'm doing my math right. We would definitely need more time. That would definitely give us more resources as far as custodians being able to clean, more nurses being able to set up. A lot of things needed to happen yesterday. Larry Lawrence and his entire crew would have to stop working at every other school and be at Granby. Every custodian would have to be ready to come over and get these classes ready and moving forward. Ms. Lane would have to get with her nurses to come up with specific criteria for those rooms. That room, for those that may have a temperature, that needs to be set. With the additional resources and the space that we have for the class size, I think we can do it. But there's still a lot of questions that need to be answered so that when it's asked of me by a parent or by a board member that we have that set in stone. But I do believe with all the additional resources, the chances of us being more successful greatly increases. Yes, sir. If you give any one of my teachers 3 groups of 3, what we could do with that is amazing. And then having a 5-year-old doing the remote is challenging. You know, part of our mission is developing a love for learning, and our teachers do a great job and have done even better work this summer preparing for virtual school. But just being with those kids and being with the teachers and being there, that is better for our age group. 75%. And again, don't quote me on the exact numbers, but I think it was 75.
Is that going to cause, in your opinion, your best estimate, more headache or less headache for a parent who said if possibly has a child in 1st grade and 4th or 5th grade in local school? Do you have any insight on that?
As a parent with multiple kids, and another thing that you work with parents, we let parents know now, because every kid gets excited about getting that blue card about 3 or 4 days about who their teacher is. These parents need to know now, I'm on Monday, Tuesday, I'm on Thursday, Friday, because they need to make arrangements. So we need to make sure parents have plenty of time before we implement Plan B so they can make child care available. As far as a 4th grader being at home alone or supervising a 5-year-old, that all depends on your own child, but I wouldn't have left my 4th grader in charge of my 2nd grader or 1st grader. My 11th grader in charge of my 7th grader, yes sir, I have to do that, but every circumstance is different. We're going to get cases where I need to come on Thursday, Friday, or I need to come on Monday, Tuesday for very specific reasons. That could be challenging. But I'm going to leave that up to every individual parent.
Well, I think a lot of parents, the concern that expresses me a lot is, you know, 2 working parents, working 2 full-time jobs, having to come home, just like most of us, and do the at-home virtual learning in the evenings. And I think probably most parents would be appreciative to have those 2 days of teacher face-to-face that will supplement their at-home, the virtual learning. Can I get a follow-up with that? Sure. Rhetorical question. I mean, you don't have to answer it. But are you
prepared on August 17th with a contingency plan with every kindergarten class when one kid has a symptom, because if they have a symptom, automatically everyone quarantines for 10 days.
We would begin, the way our teams have been working with the same we definitely have to sit down and make sure that our plan B criteria is set. But I do believe we're working with some very intelligent folks that can come up with a plan. With all the extra nurses, with all the extra help, I do believe we can have a plan in place. We're going to have folks that are going to have to teach remotely anyway. So if the teacher has to be at home and is not showing any symptoms, she then could become the remote. And this is just me talking out loud without planning, but there's a possibility for everything. The faith of a mustard seed. I mean, if that faith is there, we can kill it. We'll put the mask back on.
Larry Lawrence, what do you think? I wouldn't have asked that.
I think Plan B is achievable, not affordable. You can't afford it. I can't keep up with them. I got 2 maintenance guys. He said my whole staff would come help me. I've got air conditioners popping. I've got things going on in your system. I can't keep up with them. I'm not going to sit there and tell you I can. And on top of that, supplies that you need, if I don't buy them that instant, they're gone by the time I get a PO through our system. And I can't guarantee that I can have everything he needs by the time he opens up. I can't meet the time. Cleaning supplies, plastic for these shields, plexiglass, the sanitizer, we're having a time getting anything. No, I'm not going to do anything in the classroom. I'm just talking about for the around the desk areas, the front areas of the building. That was our plan to put it there anyway. So when the parents come up, they wouldn't have to get there. No, we're planning on doing anything in the classrooms because they got to be 6 feet apart. I agree.
I mean, plexiglass in the office really shouldn't be needed.
Tell Mr. Lazar that. You know? Yeah.
I know that's going to be a really, really just like people knocking on my door in my office and say, hey, why can't I come sit on the couch?
Right.
I'm sorry, but you can't.
Right. Yeah. It's a lot to it, and I mean, I've been on these committees with some great people, and not that I'm against just playing the ball, I'm just saying, we got 3 or 4 weeks. We got 3 or 4 weeks to put this together, and I just don't think I can do it on top of, plus any extra money that we need to put this together. Where's that coming from? We're already pulling money out of maintenance or something. This we're hoping the state or the federal government gives it back to us, but who knows? You know, the state, the county's done a great job of giving us money and working with us, but you know, we can't keep hitting everybody. But I don't think if you're going to do it, I think you need to stagger when he opens up, because I don't think we can pull it together. And I'm very concerned, which was brought up earlier, let 1 or 2 teachers catch it, get sick. Now we're stopping. We've got to go back to Plan C. I think it'd be a great idea to do Plan C for the first 9 weeks and evaluate. Because I think.
I understand.
Yeah.
Just like we were talking about earlier.
Yeah.
I don't personally don't think anything changes from Plan the first 9 weeks to the second 9 weeks.
I don't either. Nothing.
The exact scenarios could play out in the second 9 weeks, and we get to halfway through the second 9 weeks, and we're talking about the third 9 weeks, and it's the same conversation. So you might as well just reserve yourself to the fact of virtual learning all year.
Except for 10 with little kids, we don't even have to split the school in 50%. Just because of the high school scheduling and class size, we discussed this already. We're not even sure how to get to the school where we did the A meters. And it's not just Camden County, as we talked to our counterparts throughout the state. Everybody's having the same issues. There's a question here that nobody can answer at this time. And I agree with you. I think the 9 weeks and then 9 weeks, I'm not sure we'll be anywhere, but I really think we need to try 9 weeks, and at the end, maybe extend it, but maybe by that time we can go to A. I wish B was off the table, because it's unachievable when you really get down to the mechanics of it.
I
Yeah. Anyway, I didn't mean to get off on the tangent. It's just, there's a lot to do here in a short period of time.
We don't need the A and B group. We need, if they're wearing masks, why can't they be closer to 6 close what we need and get them all in? That's gonna be tough too. That's another tough thing.
So you're having a hard time getting hand sanitizer and any of the things that they need?
My supplier doesn't have, we ordered, they can't come in, they can't get it.
Well, we can't get it either. And another
sources, everybody has that problem. It's getting brought up to the country. But we're trying every day.
So we have a motion on the floor from Ms. Abbott to accept the superintendent's recommendation to open school under Plan C.
I've got a question before I move. Okay.
Under Plan C with a 9-week. Plan C for the first 9 weeks of school.
How can we have a discussion? Before we vote on that? Okay. My main question is, like you said, we were thrown into the virtual learning last September. Nobody blamed anybody. We did the best we could. I just want to be sure that if Plan C is what we're going to vote on here, that we can ensure that there will be daily instruction given every day to these students this time equally across the board for every subject. Some type of daily instruction. Let's see. That keeps that curriculum moving forward.
A robust Plan C,
Yeah, robust. This is something that ensures there's daily instruction, hopefully through our video recordings, maybe the Khan Academy lesson, that something where these kids are getting something that they would get that they were sitting in that class.
Could we possibly table this until we heard the follow-up presentation to come to next learning plan before we take a vote on that motion? So that I think I was satisfied with Kevin's answer and probably the rest of us as well.
So Mr. Purcell has made a motion to table the current motion after the second presentation. Is there a second to Mr. Purcell's motion? Seconded by Mr. Heath. All in favor say aye. Opposed? Motion carries. So we want to table that motion after Ms. Anderson's presentation. Is there any further discussion on Dr. Farrell's presentation? Seeing none, Ms. Anderson? Virtual learning plan update.
Good evening, everyone. Thank you for allowing me to be before you tonight. On last week, we discussed in depth the 15 components that the Department of Public Instruction asked for all LEAs to implement. We did some great discussion talking about those points last week, and I am here tonight to first give you numbers for our current remote instruction program. We have 178 students currently signed up. 67 of those students are at GPS, 34 at CIS, 19 at CMS, 45 at CCHS, and 8 at our early college. Additionally, I did submit on last Saturday night our district remote instruction plan to the state, so we did meet that deadline, yay. But I wanted to focus my time tonight. I've heard a lot of discussion about the remote instruction plan in the spring. As many of us all know, that was something that was thrust upon educators throughout the United States. With that being said, educators, we are resilient, and our teachers, I believe, did the best that they could based on those circumstances. I also understand that there could be places of improvement, as our superintendent has stated, and as the leader of the remote instruction team for the district, I am determined to ensure that what transpired in the spring does not occur again. With that being said, I worked diligently with several members of our district. We had principal representation, we had EC representation, we had content teacher representation, and coaches on our team. With the district plan, we are now at the place that I am ready to meet with principals so that we can clearly go over the expectations that have been outlined by the district remote team. From there, I am charging principals to then create their own remote instruction team within their buildings to ensure that there is a daily instructional schedule for teachers and students to follow, to ensure that the learning management system that we are using is utilized and updated for our parents and our students, along with providing our parents with step-by-step instructions on how to access Google, if we're using Google, or Canvas. Also, I will be ensuring that our principals and teachers have clear grading practices as well as deadlines for submission. Our teachers will also be expected to answer students' questions and parents' questions. We will also have technical support at each of our schools. Attendance is also a priority. We have already set that up, that by 9 o'clock every day, students are expected to complete a Google form. We are also dedicated in Camden to ensuring that we are providing equal access to all of our students, especially our students who are receiving EC services, our 504 students, our English learners, our academically or intellectually gifted students, and our McKinney-Bento students. Furthermore, I do recall on last week there was discussion concerning social and emotional learning strategies for our students. It is our commitment to ensure that we are working with our counselors as well as our social workers to check on our students who may be in need of support. We also have included online and offline resources for all of our students. So I am here before you tonight, board members, to say that I do know that there are areas of improvement for the remote instruction for our students, because I believe that at Camden, we provide a world-class education that is seen in our scores. So in order to continue on that trajectory, it is my duty to ensure that the things that I have shared before you tonight are implemented, because I do believe in doing things with excellence. And in order to make that happen, it is my job to get in the trenches with the principals and to work with them from now until we are back in the building if we decide to go that route, to ensure that our students can feel some sense of normalcy. Are there any questions for me at this time?
Are you going to, will each of the individual schools' remote instruction plans will come back to you for your approval? Will you be the deciding authority? Is they going to have to come back to the board for us to approve each one?
No, so at this time, we currently have plans already created by each of our schools. So now it will be my job to meet with the principals and their committees to ensure that what we have on paper is actually what we are doing. Because what I don't want to happen, Mr. Purcell, is that we have a lot of words, but no action. And I do believe in accountability. That starts with me. And then I also expect that from our principals, and I know our principals expect that from our teachers. And so we will work to ensure that that happens. Is that going to be easy? No. But we have a job to do, and that job is to ensure that our students get the best possible education under these impossible times.
And just for clarification purposes, the student or the parent can fill out the Google form anytime before up to 9 o'clock.
Correct.
There was a lot of phone calls that
I've heard
that they thought they had to do it at 9 o'clock every day, so this morning clear for
yes, sir.
from wake up to 9 o'clock, as long as one of them fills out that form.
We're good.
That's to take care of the attendance.
And that's for Power School. In the spring, that didn't happen, and so DPI, we need that to be accurate. And so that's why we went with the 9 o'clock, to make sure we can get that then to our data managers.
Any other questions for Ms.
there going to be uniformity in trying to have teachers across the board? For example, I know every kid's different, but my second grader, we might spend 2 hours, 2.5 hours today doing her work. My sixth grader might spend an hour, but there's a lot of variability in the amount of work that each child has.
Right. So it will look different at each school. And that's just because of the level. We can't expect a kindergartner to engage online for 2 hours. They don't have
my
attention.
second grader to have more, or my sixth grader to have more than my second grader, but it was.
So we're working on that. I can give you a prime example. I know at the high school, for instance, every teacher will be able to assign students at least 1 hour of work per class. Because what we were finding is some teachers were assigning 6 hours of work, some teachers were assigning 30 minutes, and so kids were unable to complete their task. So at each school, we will have a clear plan on how much instruction, whether it's synchronous or asynchronous learning, that must take place daily. Again, this goes back to ensuring that the expectations that we have in place are followed. If they are not followed, then that goes back to accountability. And so I will be ensuring that we are following up with our teachers to make sure that they are doing the things that we have set for them to do. Yes, sir.
Thank you, Ms. Anderson.
Thank you.
Before we go back to the next part of the agenda, there is a motion that was tabled to the superintendent's, made by Ms. Abbott, to the superintendent's recommendation to start school under remote learning 100% for the first 9 weeks of school.
Second.
Seconded by Mr. Purcell. Is there any further discussion? All in favor say aye. Opposed? Motion carries.
And just to be clear, that was for all schools. We eliminated the possibility of K through.
We can still make the motion for K through.
We discussed it earlier. I was under the assumption that all schools, but
Our motion is for all schools. Is there delineation?
it would be further K through. Kevin voted for that too, so that's 2-2.
If the K3 was eliminated.
Mr. Chairman, can you pull the board? We couldn't hear how they voted.
I wasn't 100% sure if that was for all schools or Jason could still make a motion for his K3.
It didn't sound like to me everybody voted, and I would just like to have the board poll on how they voted on that.
Did you agree on that? If we vote yes on that, can he still make a motion for K3? That's my question. He can. Okay, then I'm yes with that. Yes. You're yes with what? If you can still make your motion for... So you're going to... Well, yeah. Well, I'm yes for the C. For that.
Can we re-vote on that? Can we re-vote and make that clear?
Yes.
Shouldn't you make your motion first? Yeah, I was going to say, huh?
Jason should make his motion first.
Oh, because I did not hear a vote from Kevin.
Yeah. I wasn't sure.
Yes vote.
Yeah. I wasn't sure how to vote because I wasn't sure if that eliminated Jason's ability to make a motion on K3. That's what I'm saying.
I didn't want to eliminate Jason's ability to make a motion for K3, so I didn't know how to vote on that.
And I'm not going to vote yes to eliminating everything in all schools I understand there's another motion that can be made up K through 3, but that just doesn't make sense to me.
It doesn't make sense if we argue that we can't do it, that he can then make a motion that now we can't, but maybe we can. That's a good question.
He can make the motion to amend the motion.
Okay, okay.
Yeah, I'll say with the fact that Sissy's motion with it not being limited to a certain segment of schools would then apply to all schools. But then if Dr. Banks was to make a motion to have in-person for K-3, that would override all of Sissy's motion. That would just override and change the portion for K-3. So I think both can still happen. You can have a motion to reduce Sissy's motion. There's nothing to prevent that. But I would say right now, Nita's over there just probably drawing the doodle.
Yes, I need it.
Yes. Yes,
For Sissy.
Yes.
You can put me as a yes too, if we're going to make another motion.
So I understand that everybody voted yes.
According to them, that's what it is.
That's fine. That's fine.
Motion's already passed, so.
I'll amend my vote.
Child nutrition, food and supply bids, Mr. Long.
Good evening. You should have a package where we put out the bid. We're part of the 13 county co-op for our food and supplies and stuff for our kitchens. And we put the bid out. The state did after they got all the numbers together. Basically, our bids are just about the same as it was last year. And on our other stuff that we use, the drinks and everything in the kitchen, we rolled those bids over and everything. So basically, it's very little increase in cost from last year to this year, and I'd love to get it approved so we can continue moving on.
My recommendation is that you approve the child nutrition, food, and supply bids as presented by Mr. Lawrence. Second.
Motion by Mr. Heath to accept the superintendent's recommendation for child nutrition, food and supply bids as presented by Mr. Lawrence. Seconded by Mr. Purcell. Is there further discussion? All in favor say aye. Aye. Opposed? Motion carries.
Thank you.
Mr. Lawrence. Ms. Hicks to discuss the CCIP grants.
Good evening, everyone. Board members, tonight I am proposing the 2020-2021 Comprehensive Continuous Improvement Plan, otherwise known as the CCIP, grant application for board approval. Within the CCIP are the Title 1A, Title 2A, and Title 4A grants. For Camden County Schools, these entitlement grants establish a targeted assistance program at Grandy Primary School, Camden Intermediate School, and Camden County High School. The purpose of the CCIP is to provide students with extra instructional support, teacher professional development, and instructional resources beyond the regular classroom to help low-achieving children meet state standards in core academic subjects. In the packet that you received tonight, you will find the proposed planning allotments for Title 1A, Title 2A, and Title 4A grants for the 2020-2021 school year. Are there any questions for me? If not, I'm respectfully asking for approval of the CCIP grant application for said grants for the 2020-2021 school year.
My recommendation is that you approve the CCIP grants as presented by Ms. Hicks.
Motion by Mr. Purcell to accept the CCIP grants as presented by Ms. Hicks this evening. Recommendation of the superintendent. Seconded by Ms. Abbott. Is there further discussion? All in favor say aye. Opposed? Motion carries. Thank you, Ms. Hicks.
Thank you.
Ms. Lane to discuss student driver's education contract.
Good evening. The student driver education contract is up for renewal this year. It renews for 1 year with the option to renew it subsequently for the next 2 years after that. The only change in the contract is the price of the student education, and it has gone up $15 per student. That's the total package, both behind the wheel and classroom. And that brings us in line actually with the other counties surrounding us. We were a little bit below that. So we will be, the total cost now will be $210 for classroom and for behind the wheel. And I talked with Ms. Norfleet, and we have enough funds coming from the state so that we can absorb that rather than pass that on to the parents.
Absorb the increase or absorb the total cost of
The increase, we charge each student, I think it's $65.
I just wanted to make sure we're clear.
Yeah, no, that's to absorb the increase.
My recommendation is that you approve the student driver's education contract as presented by Ms. Lane. Motion.
Second. Motion by Mr. Heath to accept the superintendent's recommendation for student driver's education contract as presented by Ms. Lane, seconded by Dr. Banks. Is there any further discussion? All in favor say aye. Aye. Opposed? Motion carries.
Thank you.
Okay, I have the privilege of presenting you the 843rd edition of the student calendar. And the calendar that you have in your packet, is actually set up for Plan B. Because we have the Monday and Tuesday days offer instruction, Wednesday is remote learning for all, and then Thursday and Friday is for, face-to-face instruction. I'm recommending that we follow this calendar, even if we go into Plan C, because it has within the internal part of the calendar, everything just like it was with the calendar you passed May, with the exception that we start on August the 17th. Okay, the early college calendar that you have a copy of had to be revised because I panicked one day and realized that we can't run the buses if we're on Plan B for just the early college on Wednesday. So we also are obligated to do the social distancing and everything else with the early college, just like we are with all the other schools. So the early college will now follow the AB schedule should we go to Plan B. So their calendar now matches traditional school calendar, with the exception they have an earlier start date and an earlier finish date. But all the internal dates for holidays, annual leave, early releases and all of that stuff, it matches with the traditional calendar. And I'll probably be back here next month with the calendar. It's a revision, yes, sir, it's not. Yeah, it's a revision.
All right, so my recommendation again is to approve the revision.
Motion by Dr. Banks to accept the superintendent's recommendation for revisions to the 2020-21 school calendar as presented by Ms. Lane. Second by Mr. Purcell. Is there any discussion? All in favor say aye. Aye. Opposed? Motion carries.
Thank you.
Thank you, Ms. Lane. Superintendent Farrell is to present a resolution for supporting local patrol school.
I
At the request of a board member, we have written a resolution for the board's consideration requesting that the governor allow local flexibility and control of how to open schools in August. And so with that, it is in your packet. I'll turn it over to you. Mr. Governor.
So is there any discussion on the topic?
Will, if you could go over with us one more time where we would stand if we did this on our own?
Adopting a resolution to be sent to the governor.
Well, I mean, as far as adopting the resolution, but I mean, if it actually passed.
She wants to know if we can see the governor and he approved that.
I wouldn't say just adopting a resolution, making it known that you desire school flexibility. It would lead to any type of litigation. You're just making it known. Probably feelings that are felt by every district throughout the state. And I think if you were to move forward with adopting a plan of school attendance different than what the governor's outlined is allowed, that would be where we would have some concerns. Just adopting a resolution saying, hey, we would like the option to make that decision.
And that's what I'm saying, if it did pass by any, I mean, if we actually.
So you're saying if you adopt a resolution and then the governor grants said resolution,
right,
would you then have liability concerns there? Well, it would put you in a better position if you had that permission from the governor.
Right.
And then that would be a conversation the board would want to have at that point. If you were so lucky to get said permission, to figure out the logistics and see what type of permission you've actually received. Again, is that permission previously? I highly doubt that this is going to receive a response from the governor, but it doesn't hurt to try.
But it's like we were talking about earlier, the waiver. This is our asking for a waiver. If he says we can do it, then we're more covered than if we do it without that waiver.
I'd say if you had permission from the governor, if a waiver was granted to allow Camden County schools more flexibility, you would be in a better position of taking that action without that.
Right. The resolution is not asking for, if we want to do Plan A, you know, damn the world, we're going to do it anyway. It's just, it's complete flexibility, whether it's maybe going 65% in the class or 3 days versus 2 days. It's just a resolution to ask for those things that we've all sat here tonight and said we need to get different, or it's not going to work.
As long as we live within those guidelines, just like if we could live within Plan B right now, we do it. I mean, it's just asking for them to provide a different set of guidelines.
Correct.
We also share the resolution with any local, or not necessarily local level, but our representatives, our state senator.
Well, it'll be public record after it's adopted tonight, so then whatever the board desires and each of you in your individual capacity are more than welcome to pass it along.
Are any other boards doing this?
I'm not aware of any other resolutions being passed.
According to the School Superintendent's Association, not at this time, have any others.
Do you want to bring up one?
I make a motion to accept the approval of the resolution.
I'll second. Motion by Dr. Banks to accept approval and adoption of the resolution supporting local control of school opening, seconded by Mr. Heath. Is there any further discussion? All in favor say aye. Aye. Opposed? Motion carries. Superintendent's recommendation from closed session.
Can I add one more before we get to the superintendent's recommendations?
Yes, sir.
Could I make a motion to at least begin developing a plan? I know it's going to be hard to set a timeline on this, but maybe by the first week of September to try to get K through 3 on Plan B. believe 4 through 12, Plan C. For the first 9 weeks, until sophomore discharge. Whether it be governor's permission, might get this time, if he decides to grant this resolution, or waiver. And also, you know, by having all that support focused on Granny Primary School, I'm not going to say it'll be a test case, but it would probably be, you got lowest risk kids. Staff survey was overwhelmingly that they want to get back. If we can focus our nurses, our janitorial services, cafeteria, I mean, you could even use the cafeteria, if we utilize cafeteria at all, utilize cafeteria of CIS, have those 2 facilities at Granny Primary School disposal. Might be time to work out some things with a smaller group that we could learn from and apply if we're able to phase in other areas.
Yeah, now second that motion, and Larry, I hear you, but it's like, if we can't make it work for one school, how the heck are we gonna make it work for all schools 9 weeks from now? We gotta try. I mean, if we can't make it work for one, don't work.
I'm a team player, what we gotta do.
And we had 82% of our parents wanted us to get our kids back in school. So it's hard to ignore that voice when you know we've got that much community parental support. It's hard not to try at all to do what's best for our kids. Because I'm honestly concerned more about the mental health effects, the lagging of education for kids that don't have support at home. My kids are going to be fine. But there are kids that don't have internet access, don't have parents that really care, don't have parents that have the time because of work. And I mean, it's our duty to do as much as we can for our kids. So I want us to do as much as we can for as many as we can. That's why I'm pushing for this.
Can we set, and I know it's hard to do in this way, set around the first, my concern is a little twofold. One, what happens if we don't hit the mark by that date? We've already told the parents we were going to do. Secondly, if we set it, we need to set it for 31st September, whatever, because parents are going, we say it tonight, they're going to start planning.
Yeah,
we can't come up with
the first
no, I'm not saying word, but the motion was, I don't know, rough. I mean, if we do it, let's set it for this date, because the parents are going to act on it as soon as they see it tonight. But I heard Mr. Lawrence's comment, and Mr. Lazar.
If Mr. Lazar was good as input in,
yeah,
September, school starts back on August 17th would be the official start date, correct? So September the 7th would be, September 8th. You even got a long weekend before that.
I'm gonna be devil's advocate on that. If you do that, then that means you're gonna start your
Group A on
one day on Group A, have a remote learning day.
So you're gonna force Mr. Lazar into the 31st.
Yeah, 31st. Sorry, Lazar, we gotta get you.
What about that? We met as principals and cabinet, we were discussing a plan for the entire county. We came up with concerns that were definitely legitimate. Now you're asking, not Tim Lazar, we need to ask Dr. Farrell and his cabinet to go back again, looking at, now that we have all these additional resources, can this plan work? So I would like to have time to meet with my co-workers and that team to say, now that we have these nurses, now that how would that look? Before we even set a date and tell parents that September, whatever, we're coming, because then we're supposed to open doors. I would like to, just like we did with the principals, say, here's the concerns, present that to you, here's the pros, here's the cons, then set a date.
That was my question about that you was how comfortable are you? It's your school, they're your kids, they're your parents.
It's our school.
It is ours, but that is Mr. Lazar, the principal of Green Primary. If you make a decision like that, you have to base concerns and make sure it's together, you're gonna have to pull on all those people.
Absolutely.
How comfortable are you if you overview that?
Yeah, earlier.
I'm asking to plan, again, that you can increase the chances. We've met and had a plan for every school to open. Now you're asking, can we do one? I would like to have my guidance of my superintendent and cabinet to discuss how would that look, and Mr. Mizell, before we set any date of making it happen. You definitely increase the potential with all the resources, the nurses that we have are solid, guidance counselors that we have that are solid, teachers are solid, but we need to make sure, I want it in writing, because if you're saying my name is on it, and I'm telling you and these parents that the board made the right decision in trusting us, we're going to have all our ducks in a row before we just jump right into that.
But technically, we are giving you like 2 extra weeks. If we had to vote for the city budget, we need to take all schools. We would have to done it by the 17th day.
I just need to know how that looks. I just need time to look before we say a date coming back.
So how about this? School starts on the 17th. And if you went with the Labor Day suggestion, or the Tuesday after Labor Day suggestion that Dr. Banks made, and I hear Mr. Open is going to already up front slight your Group A students, but that would give you, that would be 3 weeks of remote learning for Granny, and then go into face-to-face. That also gives you another timeline. That gives you 1, 2, 3, 4, 5, 6 weeks to plan. We have a board meeting in August. So, and again, as I said at the beginning, if we, we will have to obviously funnel some resources and thinking and time toward that, as well as the remote plan for the other schools. So thinking out loud, forgive me for that a little bit, but if you go too deep into September, and you're 6, 7 weeks in, then we're already only going to see until 9 weeks anyway. So we don't get as much time to see if we can make things work, figure out the details of some things that didn't work, and then we can correct those so that when we're ready to open them up to other schools. So I guess from my perspective right now, and someone in the room might think differently, that's certainly fine. I'm open to that. But with 6 weeks of planning for that, and starting after Labor Day, that might be the best to shoot for right now. Knowing though that we do have to start with remote learning on August 17th. So once we get to that point, our teachers and staff are going to be focused on those things as well. So,
It was just last week we voted to go with Plan B and C and start on August 17th.
Yes, sir. Y'all should do the right on me on 17th as a possibility. I guess, yes. You're going to get more time. I think what I'm trying to say, and I'm not doing a very good job of it, is that I think that's a pretty good timeline. We could say we're starting remote learning in all of our schools on August 17th. We are shooting for the Tuesday after Labor Day, or whichever day you all decide on, pretty close to that week, or maybe the following Monday, whichever you all decide. That would be our goal for starting face-to-face instruction at Granny. Okay. And then we have an August board meeting where I think it would be important for us to bring back to the board all of the things that we have done to get us ready for that, and then we still have a number of weeks before we're expected to start that, to say, yes, we feel like we're definitely full steam ahead of this thing, or we need a little more time. So,
Talking about bringing things in easier, you got one day with Group A, and then a day of all virtual learning. So even things that you need to learn and tweak from that first day, you only got one day instead of 2 days. You got a day there to play around with just a little bit.
we also looking at, yes, simple plan C and then plan D. We also got to know how many people are going to be remote, and then staffing behind dividing that up. And schedule.
Are you referring to the students whose parents select option or total remote, the 60-something?
So now you got to schedule those kids now, so that when we do go to, if we go to plan B, those are already in classrooms and are already going to be more planned.
And the cutoff for the application is?
Next Friday.
Okay.
Would you like to repeat your motion? All right, so I'll make a motion again to begin K-3 instruction September the 8th, under Plan B, pending any other scheduling conflicts or changes. Is that comprehensive? Everybody hear the motion?
That's second.
All right, so Dr. Banks has made his motion to the K-3 start under Plan B as of September 8th.
I guess you should say in virtual learning also. Yeah, we would have to do that.
So there's been a motion and Mr. Heath has moved the second. Any further discussion? Any further discussion? All those in favor say aye.
Aye. Aye.
Opposed? Motion carries. Superintendent's recommendation from closed session.
My recommendation is that you approve the personnel report as presented by Dr. Berry in closed session.
Motion by Dr. Banks to accept the superintendent's recommendation for personnel as presented by Mr. Dr. Berry tonight.
Second.
Seconded by Mr. Heath. Is there any further discussion? All in favor say aye. Opposed? Motion carries. Announcements for board members. We will be holding the junior student board member interviews. Will start at 5:30. There's no conflicts with anyone on August 13th, which is our regular meeting night. Future conference date for North Carolina School Board Association's annual conference is still slated for Thursday, November 5th through Saturday, November 7th. Anybody have any other future agenda items they would like to see added or any other business for tonight? Motion to adjourn. Motion by Ms. Abbott to adjourn. Seconded by Dr. Banks. All in favor say aye. Aye.